Hello everyone, welcome to Indontics. This is Professor Dr. Padmini. Today we discuss about gum health and gum issues, what we commonly see. So I'm a gum specialist, periodontist and implantologist. I do laser specializations and laser treatments as well. So basically, generally the most ignored problems in any dental arena is usually gum problems. So why? Because unlike your cavities, unlike tooth sensitivity and all, usually when patients have got these gum issues or gum infections, they are usually painless and they go unnoticed until you go for a checkup with your proper dentist or a specialist, in fact, who can probe your gum and then they can detect, yes, there is some kind of gum infections. So since there is no pain, it is naturally ignored by most of the individuals. How to know that you have gum issues or not is basically based upon certain signs and symptoms. You can self-evaluate yourself. Like for example, whether you have gum bleeding when you are brushing or not brushing, okay? So number two is whenever you have bad breath, right? When you talk and all, when you're feeling that you have a bad breath other than like morning breath and all. And number three is like you notice that certain teeth are slightly shaking or you are unable to chew the teeth with the very effectively. Like for example, the strength of the tooth has been compromised and you may feel that because the bone loss could be happening around the tooth and that makes you not very effective functional, right? So the other important thing is sometimes you may also notice that there is spacing that is forming between the teeth. Naturally, you may not have any space between the teeth earlier, but as the disease is progressing, you may notice that there is some space that's happening between the teeth. That is also one of the signs of the gum infections. And apart from that, you may also notice the gum level could be receding down. So if it is a lower gum, the gum could be receding down or the tooth may appear more longer. So that is one of the very common signs of the gum infections also. And apart from that, mostly gum appears to be swollen. Okay, so gum appears to be swollen, but whenever all these things are happening also, you don't really feel pain. Some other issue, some people also complain that food lodgement. Whenever they're eating food and all, sometimes they feel like in between the teeth, especially in between the teeth, if the food is lodging, that also could be a sign of gum infection. Other than that, you don't notice usually pain in the gums, but the kind of feeling what you feel when you have gum infection is like an itchy gums. You feel comfortable when you bite on something. You feel like something to poke inside the gum and all. So these are some of the common symptoms you may notice when you have gum infection, and you have to really go to your dentist or your periodontist if possible, so that they can evaluate thoroughly. They will take a full mouth panoramic image or X-ray to evaluate to see how is your gum level and how healthy your gums are. But gum infections nowadays, they are staged into stage 1, 2, 3 and 4. So there are 4 stages of gum infection, like how we do for cancer staging. We also have 4 stages in gum infections, which most of them they don't tell you recently. But stage 1 and stage 2 with minimal treatment you can get away, and it is mostly stage 1 is 100% mostly reversible. Stage 2 onwards you can get back and still maintain your natural teeth. Stage 3 and 4 may require some surgical options or teeth replacements depending upon the severity of the teeth. Stay tuned for more updates and more information on your gum health at Indontics. Thank you.